Now we address other topics. The Bolivian Ministry of Health reported a new record in the demand for vaccination, as well as a fall in COVID-19 mortality rates. Our correspondent Freddy Morales has the story.
With a health emergency declared a week ago, institutions are compliant with the restrictions. Anyone who is not vaccinated will present a PCR test as required. And there is another possibility. If a colleague does not present an ID card and is not able to take the test, he or she will only be able to participate in a section virtually. I recommend that my students, teachers, and administrative staff get vaccinated, because if you are going to take the PCR test, it costs you at least 400 pesos, and every time you use it, you have to do it again. I recommend vaccination. With the increase of new infections due to the fourth wave, there is also a growing anti-vaccination campaign for religious reasons, misinformation, or based on myths. The government is responding with verified data. Remember what happened in the first wave? There was the collapse of cemeteries, crematoriums were not able to keep up with the demand. The morgues of our hospital were full. There were reports that the National Health Fund had established cold chambers to store the corpses. We are not experiencing that situation right now, despite having a huge increase in cases, 34,000 cases in 1 week, but despite this, the mortality rate is still below 1%, 0.8% to be exact. Despite anti-vaccine campaigns, a record immunization rate was recorded on Monday, with more than 140,000 doses administered in a single day. Severe cases occurred in people who have not received the vaccine. On average, 8 out of every 10 patients hospitalized in ICU units or who have died are unvaccinated people. And although this is a painful reality, we must convey as such to our population in a country where the vaccine is available. Among the measures in place due to the health emergency are the requirement of a vaccination card for all official procedures and entry to closed space, price controls for medicines to treat COVID, a ban of the suspension of health service, and prohibition of excessive charge at private clinics when admitting patients to intensive care units.
Freddy Morales, teleSUR, Bolivia.